Good morning, good afternoon, and good evening. Welcome to the 1021st day of continuous and uninterrupted Zoom session of Ifph. Let us start today's program with a silent prayer for 1 minute. Thank you. Today we have with us Dr. Shelly Sharma Postle, MD, PhD, has been awarded a PhD degree from Defense Minister of India, Sri Rajnath Singh, in 2023. Did diploma in ICAS degrees. Had done advanced homeopathy course in Greece, studied psychiatry, and has done fellowship in psychiatry and counseling. Practicing since 2011. Is running 2 clinics in independent Maharashtra. As a researcher, Dr. Shelly Sharma has been published and presenting her scientific research papers in nationally as well as internationally, Dubai, Germany, Italy, and many more. Has been publishing research articles in scientific research journals nationally and internationally. Has awarded the best case presentation in Liga 2019. Invited national radio channels to educate people about benefit of homeopathy. Ex-associate professor in physiology department, invited as a key speaker to many colleges, conducted educative webinars for students and doctors nationally and internationally, conducted many health awareness camps, talks for patients. And the topic is scope of homeopathy in acute emergency pediatric conditions. We all know that the emergency conditions are very sensitive and very important, especially when in the case of the children, it becomes further more important. So we all know that homeopathy has got a lot of medicines and potential. So we must exploit, because it is always capable of treating according to symptoms and situations without even diagnosing the case. Moreover, it will not hurt the people. That is the most important thing. So on behalf of Ifph, I am welcoming Dr. Shelly. You can have the platform for next 45 minutes, followed by we have a 15 minutes discussion. It's over to you, Dr. Shelly. Please proceed.
Yes, thank you, Dr. Manoj, and I'm very glad to be present today. Thank you to this forum for giving me this opportunity to talk. So, am I audible, Dr. Manoj?
Yes, of course.
Yes, I will see. So I have this message: host is disabled the participant screen sharing. So can you just on that for me so that I can share my screen?
Yes, you can share. You are the co-host.
No, I am not. I'm getting this message: host is disabled participant. I'm not able to share my screen.
Yes, please share. I think after joining, you just. Now you are the co-host, you can do it.
My today's topic is, as Dr. Manoj said, it's a very sensitive topic because it is on pediatrics, right? So before I move ahead, I just would like to thank Dr. Samuel Hahnemann, because I do not know what words to say, but he has made such a wonderful science, which is homeopathy. And I have realized it once when my dad was in coma and I was really hopeless in my life, because he was advised to undergo craniectomy. He had a brain injury and the doctor said that he will never talk in his life. I was in my last year of MD at that time. And then I was just talking to myself, I have been a very good reader. I've read Farrington's talks about treating comas or handling emergency cases. So why should I not give it to my father? Because if I give it to him and if he is better, I will be in a position all my life to tell my patients, yes, you take homeopathy for emergency cases. And the whole thing went beautifully. I will not go deep into the case, but I have seen the miracle. Next, he had midline shift in his brain, which was 30%. And next morning, he had to undergo craniectomy surgery. So that night, I gave him the dose. I said, my mom, mother, see, if he has to get better, he will be better in 10 minutes, or we have to go for the surgery. With full faith in homeopathy, with full faith and with full dedication, which I may give in future to my patients, I gave him a single dose. And to my surprise, in 10 minutes, he was restless. Right? And after that, Next morning, they were taking him for the surgery, and doctors performed a CT scan, and he said the shift is resolved. So that day was the day when I decided that, yes, I will practice wild homeopathy. Now, what is wild homeopathy is, I will try to treat such kind of cases. I started treating such kind of cases in my practice. I started handling emergency cases. And then here comes the pediatric cases, which are most difficult to treat because it is a very sensitive issue. We all know it very well, right? So whenever we get a pediatric case, all of us are in doubt. Is it not? We all doubt, that, oh my God, the patient has high grade fever. No. You take antibiotics for now. And then what will happen is, once you're better, we'll give you homeopathy. We do it. It's not we are wrong, because maybe we don't know the potential, how fast homeopathy is. And today I will try to show you a few cases where I can show how aggressive homeopathy can be in treating such kind of cases with homeopathy only and no antibiotics. So we have a doubt homeopathy is very slow. Second, we are having a fear of tackling acutes, because when we take pediatric cases, they are having high grade fever. The parents are panicked and they put that panic upon us. And then we are panicked. Now what to do? No, you take antibiotics, it's okay, we'll see later on. And we have a very big question, like, will we be able to treat infectious diseases with homeopathy alone? Is homeopathy that capable? What about antibiotics? Can homeopathy replace antibiotics? I'll talk about these things once we do with the cases. Should I fear fever? Sabse pehle to, we as a homeopath should be very confident that we should not fear fever. People fear fever. Patients have a fear of fever. Doctors, allopathic doctors, we have fear of fever, But I'm very sure about fever. One, I know why we get fever. Two, I explain all my pediatric patients, their parents, do not fear fever. Fever is nothing but the defense mechanism of our body to fight the infection. So we have to support the body to fight the infection. This thing I will support with some of the research articles which I have been going through of lately, why it is important to have fever. Now the next question comes is, the patient has acute tonsillitis. Oh my God, I have to give something. Let me give Barata Carb or let me give Belladonna. Should we do that kind of practice? Or the patient is is in high grade fever. Let us give Ferrum Pause. They have said Ferrum Pause work. Should we do that? And why we should not do that? I'll try to tell that also. Right? Now, should I give patents or we have a proper Hahnemannian approach? Now, next question arises. Okay, we'll go classically, but how to take such an extensive case and how to treat? I'll tell you, for acutes, be it high grade fever, be it diarrhea, I don't take more than 5 minutes of my patient with a single dose. I try to help them. I'll try, see, this is just, we have 40 minutes. I will just try to direct you, and I want you all to please understand, we as a homeopaths are not just treating fever. Remember, we have to remember that. We as a homeopath is going to support that child's immune system, which will help him for next 50, 60 years. Because if the child has a healthy immune system all his childhood and he has not been taking a lot of antibiotics, just imagine how much healthy this child will be all the life at physical level. Emotionally, how the child will be stable. Spiritually, when we say homeopathy is a spiritual science, because homeopathy has the capacity to help a person grow spiritually, and eventually in my practice, I have seen people, growing spiritually with the support of homeopathy. So we should not limit ourselves just to the physical aspect of a human body. We are dealing with the spiritual forces. We are dealing with the life force of a person. So we have such a big responsibility that if we are giving homeopathic remedy, it should be a very classical Hahnemannian approach, because we are not just helping that body, but we are helping the soul. So let us go ahead. In this presentation, I will be taking 3 sessions. Now, this in first session, I would like to cover, we'll try to cover and learn the essence of pediatric case taking. How to understand the mind of child with the art of observations. We all know that we cannot talk to the child, we cannot get all the symptoms. The only way how you can understand the child is by developing a very good art of observation. We have to differentiate pediatric rubrics, understanding and application of pediatric psychodynamics. You have to understand that as well. I try to cover up a case and how do we communicate with your little patients. I'll just try to help you with my session, right? So should I go ahead with it? Am I clear with the case? So now this is a case of a high-grade fever. The patient had acute leukocytosis and very bad chest congestion. So this is a case of 8-year-old child who had consulted with his parents for high-grade fever. Persistent cough, his chest was very badly congested with expectoration since 3 days. He had recurrent fever every 4 to 5 hours. His fever used to rise up to 103, 104 degrees Celsius. The patient had complaints of nausea and vomiting. The cough was dry at night and loose all the day, which was accompanied by vomiting. In the whole consultation, when the child came, he was a very cooperative child. I mean, I was asking him, he was telling, he was not cranky, he was not irritable. He was a very cooperative child, right? So whenever you go through you just ask the chief complaint. So, there are 2 ways how you can approach. You just try to find something striking in acute case, either physical or mental. Try to enter that case and try to match other keynote symptoms to the patient, right? Now, this is what I got from the patient's mother. The child was non-irritable. He was toxic. Yes, he had drooping eyelids. Patient was asking for sugar all the day. The mother was telling, "Bacha, he is just asking for sugar, doctor, and sugar." And the patient was very hungry during fever. So whenever he gets fever, he's asking to eat food. Aggravated eating after amelioration by drinking warm water. So this is the case what I got from the mother. We don't have much time because the child is panicked, the mother is panicked, the father is panicked, and they make us panic. So we have to try to get the maximum what you can get. And then comes a very major role, what I call is observation of such cases. So what I observe, I usually, whenever this acute cases come to my clinic, I try to check all the orifices. Hahnemann said, in acute cases, just use all your senses. So I make all my senses alert. In normal cases also, but specifically in acute. So I ask every child to show me their soles and palms. Okay, so here there was heat in the soles and palms. There was heat in the vertex. I could see redness all around. His lips, his eyes, everything was burning. The child was very dull. Redness of the face. He had strong desire for sweet. He was just asking sugar. So whenever the child was coughing, now we have to again observe his chief complaint, right? So whenever the child was coughing, his cough was, it was such a forceful cough, which was not a very usual thing which I see in my patients, So this was very important for me as a part of observation. So I noted that. And whenever he was coughing, and he was very suffocated. When he became very suffocated, right? He was panting after coughing because it was forceful, as well as the lungs were very badly congested. His thirst was on the lower side, and his thermals I couldn't get. The mother was not sure, the child was not sure. So I asked them immediately to get his CBC done. So his WBC counts were 19,781. So in this WBC count, I think any doctor will get the child admitted in the hospital. Is it not? Yes. They will start with augmentin, they'll start with antipyretics, whatever. They will not keep the child at home at such high WBC count. Now they came with such WBC count, and should I take this challenge or not? Because his chest was badly congested. There were high chances he will land up into pneumonia. Right? Now, the fever was high grade. It was 105, 104, 103, which is coming after every 3 to 4 hours. The mother was panicked. The father was panicked. The child was toxic. And then I got this challenge to be taken. So can you tell me, everyone, this is the case I got. this how high is the WBC count of the patient. Now, in such cases, okay, how do we go ahead? What kind of repertorization you will apply and what remedies will come to your mind? I would love if you all will share your inputs, what remedies come to your mind. I will really enjoy. Have you all got Sina? Dr. Shobna Verma says Sina. I also request one more thing. I just want you all to tell me why you think of Sina. See, here, as I'm telling, I'm not going to show you, see what I did. My whole intention is that I would like to show you a way that this is how we can treat an acute. This
Excuse
is
me,
how.
doctor. Excuse me. It is our method is we have discussions after we finish the topic. That's a method. Because only we have 40 minutes. That's the total time. Okay.
Okay, fine, no problem. So what I did was I took the case and I took the rubrics. The rubrics which I took in this case was appetite ravenous during fever. We have to take this. Why? Because this is a characteristic. You will not usually get a person's appetite increase during fever. So we have to take that rubric. Nausea, cough during aggravation, vomiting, cough during aggravation. A very strong characteristic what I got here was, again, cough is dry at night and loose all the day. So the mother said, ki, doctor, all the night, he gets a lot of expectoration, but throughout the day he doesn't get. So I should take this symptom into consideration. Whenever he eats food, he starts eating food, his cough used to get aggravated. His cough was forcible, as I said. I observed that symptom. I took the rubric cough forcible. Cough was suffocated because he was feeling breathless after coughing. Strong desire for sugar at the acute moment. Strong desire for warm drinks. What I again observed was heat of soles and palms and vertex. And all the orifices were red. So the remedies which are coming here is sulfur, nux vomica, arsenic, lactaces, and calcarea. So we see that here the patient is not very irritable. Okay. He is not very irritable. He is not very dominating. He doesn't have any, answer when obliged to answer. Yeah, don't talk to me, doctor. Why are you asking me? There are many children, who are nuts, who will behave like this, who will not give you answer properly. I ruled out nux vomica. I ruled out arsenic. Why? I did not find the child to be very restless, very anxious about there. He was sitting, doctor, give me the medicine. Okay, I have this. He was dropsy. He was toxic. But I couldn't find any restlessness, any anxiety in the child. Only his mother was anxious. She was a typical aconite patient. But the child was no anxious. He was instead a very confident child. He was a very confident child. He was desiring a lot of sweet. His orifices were red, suffocated forcible cough, and the remedy given was sulfur 200 stat. So here, see, I did his first blood count on 8th February, right? Then I gave sulfur on 8th. Now, in such kind of cases, it is always better to go clinical. So after every 2 days, I used to ask the patient to get a CBC done. So on 8th, I got a CBC done, which was 19,000. Okay. Remedy was sulfur. Then on 10th, I got a CBC done. His WBC count came down in 2 days without antibiotics to 9,820. So this is a good sign or bad sign? It's a very good sign. My remedy has started acting, but he still had fever. So should I be scared of the fever? No, I should not be scared because I know his body is now recovering. His WBC has come down. Still, he has infection. His body will fight the infection. He will have fever. But what the difference was, before he had fever after every 3 to 4 hours, now his fever was every 7 to 8 hours. And second important symptom, which was very important, is when before his fever was around 103, 104, now it was around 100 and 101. Okay. Then again on 12th, I asked them to do the WBC. By 12, he had no fever. His WBC count had come to 6,810. No fever, only cough, which was coming out of expectoration. So again, that was a very good sign. I did not give anything, no repetition, and I just said them wait and watch, and he was doing good. So this is his CBC on 10th. We can see his WBC count now, 9,820. Now this is a CBC on 12th. You can see the WBC count, which is 6,810. So this is the first case, which I wanted to show to you that this is how you have to take care of acutes. Whenever you have pediatric emergency cases, specifically fever or any acute condition, just try to get whatever you get from the patient. Just try to take a very detailed, don't go very deep. Just, Hahnemann has said in his organon, whenever a patient has acute, we don't need to go to a detailed case history. Why? Because he will throw strong characteristic symptoms himself. It's like, a sea with waves is an acute condition. Which is important, which is characteristic, the wave will come up, just have to catch hold of it, connect the dots and give the remedy. And now how you have to tackle the cases? Do his WBC count. So when you show the patient that, see, now his WBC was 19,000, now it is 9,000. The patient's relatives are satisfied. Also, I'm satisfied. Keep a track of his clinical, clinical history, diagnostic history, and explain the patient that ekdam se fever will not go. It will come down gradually. For 1 to 2 days, it will remain around 103, 104. Then the body will come to 100. Then it will come to 99, and gradually things will get better. And it will be the cough, which will be the last thing to go. Okay. So I'll just tell in short about sulfur child. We don't have much time. Whenever you see any sulfur child in acute as well as chronic, it's a very big remedy. You see a lot of confidence in this child. You don't see the child very irritable, very cranky, very restless. They are very confident people. They're very confident children. Usually, they are very smiling. Always they will be a good smilers, or they were a very cooperative children, like Bromium. They have a lot of ideas inside them. It's like a volcano. What is sulfur? Sulfur comes from a volcano. What is volcano? There's a lot of things inside. It just is waiting to come out. So they have a lot of ideas. They have a lot of energy. They have a lot of knowledge. They have a lot of questions. I see a lot of sulfur children coming into my clinic and asking me so many questions. Doctor, why is this? Why is that? Why is this? They'll ask you a lot of questions. And the questions will be related to what? It will be related to life. It will be related to philosophy, right? Because they are very philosophical children. You will see redness with sulfur always. And they're very smiling. In short about sulfur. So, 1 second. Okay. So what is the need to treat pediatric cases with classical homeopathy? One aspect I will share with you, that we always think, it's okay, we'll give an antibiotic to the child. Or it's okay, we are just giving anti-allergics to the child. So why it is not good to give your child an antibiotic or anti-allergic? So recently, so whenever you give antibiotic to a child, remember, the antibiotics will influence the innate immune cells of the pediatric child. Now, of the innate immune cells are those cells in your body. We have 2 types of immune system primarily, which is innate and one is acquired. Innate is what? It is a first defense to anything which is coming inside your body. And then the message goes to the acquired, where the body makes specific antibodies towards the specific antigen. So the message from innate to acquired, to make a lifelong immunity, is given by dendritic cells. These dendritic cells are type of cells which carry the message from innate regarding the antigen to the acquired adaptive immune system. And this immune system will then make a lifelong immunity towards a disease. So just imagine, this is why when a child is treated with antibiotics, they will never come out of the cycle of antibiotics. They will keep needing the antibiotics as long as they are very big or they do not develop any other major chronic disease. Because here with antibiotics, not only they kill the bacteria, but they disrupt the innate immune cells. That is why they will never gain a chronic immunity towards an infection. So just imagine how deep antibiotics affect the child's immune system. And if the child doesn't get an acquired immune system, there are high chances that the child will develop autoimmune conditions in future, but there are high chances the person will develop chronic diseases in future. So it's so important that we treat, if every child is treated without antibiotics, and best is if with homeopathy, we support the immune system all the life, right? So I've said this, antibiotics decreases the dendritic cells in the blood. So this is, this is what is the antibiotics. They not only kill the bacteria, viruses, but they affect the innate immunity, the dendritic cells. This is known as natural killer cells. And this is something which is known as, one second. Yeah, these are also lymphoid cells, right? And this is adaptive immunity. So in adaptive, you have chronic or long run protection from any infection. So the antibiotics will disrupt this. So we do not get a long-term, long-term relief from the infection. We do not get a healthy adaptive immunity. So this is the need, and this is the need why we need to treat pediatric children with classical homeopathy. Not only this, more than that, we are not just treating or taking care of care of the immune system. I'll tell you a case, short name. I remember a child, she came to me, she was a 6 years old child, and she had pyrexia of unknown origin. So she came to me in the month of March. So her parents said, since October, my child is having fever every day, around 101 and 102, right? So we have given her a lot of medicines. For 3 to 4 months, she was admitted to hospital every month. Finally, no diagnosis. Then they diagnosed it as pyrexia of unknown origin. So see, the child is having fever since 6 months, every day, right? So, there has to happen something with the child. She's getting fever. So the child came to me to the clinic. She was a very mild, gentle, very cooperative child, very lovable child. She was not touching any of my things. Whatever I'm asking, she's giving these answers very appropriate. So I came to group of remedy. Okay, this could be one of the group for this child. She could be this group, this group, this group, this group, this group. So I asked a direct question to the parents. What happened in the month of October? Okay. So they said, no, everything was okay in the month of October. Nothing happened. I said, no, tell me, remember, anything happened between you both? No, we're absolutely okay. So the child said me directly, 6 years old child, Mummy and Papa were getting divorced. And she started crying. And both the parents were shocked. And to my surprise, and to the parents' surprise, no, doctor, yeah, we were having a lot of fights during that period and we were thinking of getting divorced, right? So will this affect my child? I said, yes. And of course, the child was given magnesium muriaticum 200 bundles. Within 15 days, her intensity and frequency of fever decreased. Then she had no fever. Now just imagine that fight had such a big effect on the child's emotion. She got stuck in that emotion. Even though she would have been treated with allopathy, maybe after 1-2 years, she would have not got fever, but will allopathic medication help her to heal those emotions which were sitting subconscious? The separation of the parents, the thought of separation of the parents gets what? Gets insecurity, gets fear, gets loss of support, loss of affection ka jo feeling hai. That vacuum, no medicine in the world can fulfill other than proper meditation. And second is homeopathy. This deep homeopathy affects. So this is a major responsibility of every one of us when we treat pediatrics. Try to listen to the unspoken words of the child. Somewhere they are speaking through body, through mind, through eyes. They are somewhere disturbed. And if you treat and if you heal such souls, just imagine, you're doing such a great work of the universe. We are next to, trust me, meditation is one thing which goes to the subconscious mind, proper meditation and classical homeopathy. When you try to understand the patient at the deepest level, you can touch a soul and change its life, So we'll not go deep into it. It's another topic to discuss about. Okay, we'll go ahead. I'll show you one more case. So our aim of case taking has to be individualize the patient and the case and reach the seminar. So how to have healthy children? We are lucky. Now, I'll quickly go for the second case. It is a case of high-grade fever, again, leukocytosis with raised CRP. Okay. So this patient had WBC counts around 23,000. Right? His SGPT was, his C-reactive protein was 14. His platelet count were 5,35,000. He came with high-grade fever. Now, again, this is a case where if you not give the similimum, it will not come down. You have no other option than to go for antibiotics or to get the child admitted. In 23,000, no doctor in the world will take a risk. Treat the child at home because anytime he can go into a septic shock. So let us see the case. So a 3-year child was consulted by the parents and he was suffering from high-grade fever, cough with expectoration. He had fever every 4 to 5 hours. The cough is accompanied by perspiration with salivation. The cough is accompanied with perspiration with salivation. The child holds his chest when coughing. Now see, whatever I'm giving you now, the symptoms, just note it down. You all try to come to the remedy because here somewhere the remedy is hidden. Okay. The child is very restless. Since he is having fever, he hits his younger brother. Whenever he is not having fever, the child is just sitting, joking, making faces, he's teasing his mother, his brother, his father, is teasing everyone. And whenever he gets fever, he gets quiet and he's just sitting lying on the bed. But whenever he is okay, no fever, he is very naughty. Okay. The child does not obey the instruction given by the parents. So his mother said, like, doctor, I don't know why he is behaving like this. When I'm telling him, Baba, you have fever, don't have cold water, he will have cold water. I said, Baba, don't sit down on the floor. You will get fever. You have fever. You're not supposed to sit down. He will sit down. Mother saying, Baba, don't sit up on this chair. Sit down. Then he will sit up. He'll do opposite whatever his mother is telling. But I don't know, doctor, why he's behaving like this. He's just reacting very opposite to whatever I'm telling. He gets very angry. Now, if suppose his mother says, I shout at him, don't drink cold water. Don't hit your brother. Don't sit down on the floor. You have fever. He'll get very angry. He will go and sit in the corner and sulks. He starts sulking. Right? Now his cough is aggravated at night on lying down, walking rapidly. So whenever I get cough ke patients, I ask them to do some movements because they will not be able to give you all the symptoms properly. So I ask them to walk fast. I ask them to walk slow. I ask them to lie down. I ask them to sit to see which is the aggravating and ameliorating factor. I just reconfirm the cases. So the cough is better. Sorry, the cough is aggravated at night on lying down, but walking rapidly. The cough is after midnight, after 2 to 3 a.m. So whenever he has cough, he has a lot of perspiration with salivation. So this is something changed. So observations made is he's restless in the clinic. He is having high-grade fever. He is completely restless. Salivation when coughing. Patient was holding both the chest when he was coughing. Whenever he's coughing, you need to observe. Not all patients will hold the chest. Someone will hold the throat. Someone will hold the head. Someone will hold the thighs. Patient to patient, depending upon the individuality, the patient's hand will go. So you have to catch those gestures which are repeated. So on auscultation, when patient was asked to lie down, his cough aggravated. So you have to catch those symptoms. We'll rush, okay, because remember in aphorism 90, footnote 85, Dr. Hahnemann says, when physician has finished writing down his particulars, note down what he observes. Just note down what you observe in the clinic. It's again a very big topic we can discuss about. I'll go ahead. So observation is not just to see, but to look into. Observation is a non-verbal communication. Okay, it's a very major thing in your prescription. With fine observations, you can differentiate a lot of remedies. So as a homeopathic doctor, you have to play all the roles. You have to be detective first. So you have to take a whole case, be a detective, and hunt for something which is very important and connect the dots. Once you have done that work, you have to be a lawyer. You have to tell why to select the symptom and why not. This is the analysis and evaluation part. And then last comes, you have to be a judge. Now I have all the 6 remedies in my repertory sheet, which remedy to give. And here comes the role of your observations. You have to be all these 3 whenever you sit in a pen. It's not easy. So the remedy, whatever I gave, his WBC count we saw was around 23,000. After the remedy, his WBC count came to 11,000. His CRP came to 5,005 again. No antibiotics given. Okay. So this was his count. I did this WBC count after 1 week because the child's nature was so, I can tell you, you'll understand the remedy, you'll understand the situation. He was not obeying anything. So he was not obeying. His mother saying, go, let's go to the doctor. He will not go. He will create a scene. So I said, okay, I was observing the child every 2-3 days. I was seeing his fever coming down. So after 5-6 days, I said, okay, now get your WBC done. And the things were much better. From 23,000, it came to 11,000. Good sign. So what is the remedy? Okay, so the rubric selected was, night cough after midnight. Okay, perspiration with, accompanied by salivation. He will hold chest with both the hands when coughing. He has to. Cough better by lying, aggravated by lying, which I confirmed in my consultation. When he was walking rapidly, his cough aggravated. Again, I consulted. And see, I said 2 symptoms, mother said, like whenever we are shouting at him, he gets angry and sits in a corner and doesn't talk to anyone for 2-3 hours. So the rubric is sulky. He is sulky in acutes. It is very important to take note of it. And if mummy is telling go to China, he will go to Japan. Jana tha Japan, pahunch gaye China. Which I gave was murk. Again, arsenic is restless, murk is restless, but arsenic will never jest make fun. Mercury is a very jesting remedy. It's a very witty remedy. In acutes, it's angry, it's sulky. But otherwise, it's a very jesting remedy. He likes to make fun. He likes to enjoy. They like to enjoy things till they don't get angry. If they get angry, then they are the most dangerous people. So the remedy given was mercury 200, 1 dose. I took his follow-up every 2 days. I saw his counts, his journals improving. But a child mercury, if I said get his blood test done, he will not go. He will not allow to take blood. So many times you have to advise according to the nature of the patient. So if it's a nitric acid patient, ask him to get investigation every 2 to 3 days. If it's an arsenic, ask him to take investigation every 2 to 3 days. If it's an aconite patient, do not ask. Though he's better, when he'll go and give his blood, he'll go into a state of panic. So you have to again advise your patients according to his or her constitutional types. Okay. So mercury 1 dose was given. So remember one thing, whenever we treat homeopathy, our aim should not be to treat the symptoms. Our aim has to be to treat the process which is happening in the body. To help and support the body's physiology. When physiology is deranged, it goes into pathology. So when we improve the patient's physiology, we automatically help the patient to improve the pathology. Because from pathology, only we can come to physiology is when the body will reverse. And body will reverse only when classical homeopathy is given. No other medicines in the world has the capacity to treat the process. It's only the homeopathy and your body. If you are strong enough, your body will reverse on its own. If you're weak, only homeopathy can start that process. So we are not just treating cough, cold, fever. Don't ever in your clinic think that you're treating cough and cold. You're treating a process, you're treating a physiology, you're treating a genetic thing. So you have to think you know, it's such a big responsibility in your hands. So I think we just have 4 minutes. So we'll cover these things in our next lecture.
Yes,
Right?
that's good.
So, you know what we always miss in our pediatric prescription is, sabse pehle we try to think more specific. Cough, antimtat. Right? Fever, Parampos. Or tonsils, calcaria. No, you have to think beyond that. We rely more on parents. You know, I'll tell you a joke. Whenever I ask parents, how's a child's nature? My child is very nice. He's very good. For every child, for every parent in India, the child is Krishna Bhagwan. They are the world's best children. Though in the cabin, your child is behaving like a tarantula and touching everything and breaking all your stuff, the mother says, my child is very good. He is like, so, you know, always try to cross-check the parents and rely on your observation. Never ever miss to feel the child, feel the essence of the child. Mother's pregnancy history is very important, specifically when the child is having developmental issues or is sick since his child. And try to treat antibiotics ke bina all the acutes. Try to gain that confidence, right? And listen, develop the following skills. Listen and observe the child. Think like a child. Just try to go into his mind, you know, hey, bacha, what this child must be thinking. Give him undivided attention. Treat him like an adult. Pay attention to their imaginations. Focus on their creations. Connect with them physically, verbally, emotionally. You have to treat every child who comes to your clinic as a gentleman or gentle lady. So that child will feel connected. They'll feel heard. Think, what made this child sick? What is the child struggling to fight and compensating the health? As I said, a case of magnesium mute, right? So do not underestimate the thoughts of child. They might not be as developed as ours, but they are very powerful. Unlike some adults, children are able to retain and analyze information. And more importantly, this children mind requires a lot of attention. They need a lot of interaction. But trust me, it's worth it. Because every time the child will love coming to you. What we miss, as I said. So this was for today's talk. And I hope you all enjoyed.
Definitely, nice presentation and wonderful one, because you are the people like the young talent persons is the promise of home definitely in the coming years. No doubt about that. So time for discussion. Those who would like to participate can go to the participant list and raise your hand. A wonderful opportunity to share with your thoughts and observation on Dr. Shelly Sharma. And of course, Ahmad Hassan sir, the first person to raise hand. Yes. Please unmute, sir, and proceed. Yes, sir.
Good evening to all. Definitely, madam, very meaningful presentation, especially referring why we not use antibiotic for children, because it is concerned with the innate immunity and dendritic cells. Thank you very much for your very meaningful presentation. May Almighty bless you. Thanks.
Yes, that was Mr. Ahmad Hassan sir from Saudi Arabia. Now this Narayana Mitpale. Please unmute. Yes, you can unmute now. Please unmute. Yeah.
Sir, this is an excellent presentation in acute cases. I do have many cases with me. Shall I present these cases?
Definitely,
Hello.
you can present at a later day if you kindly contact Thanesh, who is the program coordinator of IFPH. So you can have also presentation in this platform in English, or Hindi, as you like it.
English only, sir.
Yes, definitely.
English only.
Yes, we are conducting the program for the last 1021 days continuously without a break. That's another world
Okay.
record, and you can kindly contact Thanesh. Yes, please.
This is an excellent presentation with a few symptoms, that too characteristic, that is EQRS. Dr. Shelly, I know well. We have a tour, European tour along with her. Enjoyed a lot.
Thank you,
So
Dr.
it's
Narayan. Great to see you here.
excellent presentation in Koitin also. You have given, no?
Yes, thank you.
You have
Yes, I-
presented a case in Koitin.
I think you are for the first time this platform, isn't it? Am I right?
Sir?
I think you
Sir?
are attending the program first time.
No, sir. Since 1 week I am attending the classes. Hindi and English.
Kindly
Both.
give an introduction. Could you please introduce yourself?
Sir, I am working as an assistant professor, practice of medicine. My specialty also practice of medicine. Government Women Medical College, Kadapa, Andhra Pradesh.
Kadapa. Okay. Yes. Thank you.
Yes.
Yes, and you are all welcome. You can have your presentations. Don't forget, don't hesitate. Please come forward, because we are especially looking for the college teachers, because they are the most influencing.
So already
Yes.
I sent a request to Sani sir, where I did my post-graduation at Bihar, GD Memorials. So he asked me present in Hindi only, because I am not in this state, belongs to in this state, but I study there now.
Yes. Okay.
I will present in English only.
Yes, definitely. Thank you. You can arrange it according to convenience. Yes, Dr. Shelly, you just mentioned about an important aspect, because it will
Yes.
always enhance the immunity for next 60 to 70 years. That's the most vital thing. As far as health is concerned, because everybody claims it assures on health, total health for everybody. By 2000, nothing happened. Now 2020, disease for all. That's what happened. Then potable water for all were by 1980, nothing happened. So what is happening is only certain claims. But we claims that we can just assure that it will enhance your immunity. Then another point is that about this when it selected the remedy. That's a great thing, because you just differentiated different medicines. Even acute cases, you just do the wonderful job. So you got the right remedy. So you got the remedy. Always the right medicine is the remedy. There is no difference between that. Then you administered and waited. Why you are able to wait? Because you did a hard work. That is the reason. Then again, you mentioned another important point is because the magnesium muriaticum, the parental conflicts. That is the major problem of this era. I think a lot of persons, children, definitely need such medicines, because everywhere the parental conflicts are there. They're always fighting each another without considering the children. That's another important thing, another social aspect. Now it is Haryana sir. I am sure that he will be really pleased. Sir, please unmute. Very happy. Yes, sir.
Okay, Doctor, really I am very happy, because Pakka, see, very 100% scientific method you have adopted for this case taking, and found the remedy also. But one doubt I like to ask is that suppose that child has taken some indigestible things and produced, see, such as symptoms, vomiting and high temperature, then is sulfur will cure that case?
You see, if first of all, I ruled out why indigestible thing will not raise his WBC counts. Why? WBC counts will increase only if there is an infection. He had cough. Second, whatever the child has taken, he's taken indigestible thing or what, how he will present is the remedy. Now, cause is not the remedy. How the person responds to the cause, that is a remedy. So if he had presented with the same totality, of course, yes, I would have gone for sulfur. Because we don't treat the cause, we treat the reaction to the cause, right? Which is individualization.
Okay, doctor, that is one method. I like to say, see, ailments due to.
Yes.
There is a rubric.
Yes, sir. That is also like causes producing like effects. So
Okay, see, Dr. Manoj, I am asking question to the doctor.
Yeah, sir.
Let her say.
Yes, sir.
Okay, doctor. Thank you very much.
I think, Dr. Hariharan, you please listen that I am doing this moderator works and I just came to understand that the question you conveyed to Dr. Shelly she was not properly perceived. That is why I just interfered. That's the reason. Okay. Now, Dr. Tanesh, please. Yes, please unmute, Dr. Tanesh. Yes.
Good evening, Dr. Shelly. It's a very nice presentation once again from
I think some network problem is there.
Homeopathy. As you know, today we have no problem, sir. We can manage. Nowadays, a lot of homeopathic children are coming to us, homeopathic doctors, and doctors find it very difficult to manage those cases because the most patients are taking allopathic medicine before they enter into our clinic. So we will have to look into that aspect to find the exact stimulum at the shortest possible time. And in those conditions, usually we have to give some medicine to make the children back into the normal and then we have to see whether the patient require any medicine or not for the present situation. What's your opinion on that, doctor? You follow me or not, or if there is any difficulty in understanding my question?
Yeah, could you repeat the question for me, please?
Yes, usually children are taken to our clinic, but most of the children are coming with having a lot of medicine, allopathic medicine in their kitty, and they used to take these medicine continuously, or sometimes on the same fever itself they may be taking. So at the time of presentation, that there is a complication with the medicine as well as the present symptoms also. So how will you manage such cases in the beginning? Whether you go directly to the simillimum or whether you try to give some other medication, just like no source or something to avoid the allopathic medicine effect like that. That was the question I asked.
Yes, clear, doctor. Yeah.
As I said, whatever approach, first I'll give you a very general idea and then I'll go specific to you. So whatever my approach is, I try to follow the physiology behind whatever I do. Now, for example, the child approaches, there are two conditions. One is he's in an acute condition, a chronic condition. So chronic condition, for example, he has a chronic bronchitis and he came with acute exacerbation of the chronic disease with an acute bronchitis attack. So here, first I make the child clear. See, we are going to, his mother clear. Let's see, now we are going to start homeopathic treatment. My prime aim is to increase the child's immunity. So whatever totality the child throws at that time, it can be anything. It can be his constitutional remedy, which can be his acute totality, or it can be some other remedy. I just take that remedy and I give it. And I tell the parent, if I'm very sure with my remedy, that for next 3 to 4 months, the child will keep getting the episodes. And we have to try to cover the child without antibiotics so that he is out of the vicious cycle of antibiotics. I make very clear with the parent. Any acute, you come to me. I'll tackle with homeopathy only.
Yes.
Most of the cases, I tackle those acute, whatever. Most of the cases, for example, this child I gave sulfur. He will present most of the times with sulfur. And if he's okay in other times, I will not give any other remedy. I'll wait till the child shows any new symptoms which is pointing to me another remedy. Regarding nosodes and sarcoids, in my opinion, till there is an indication of a nosode or sarcoid, we should not go to prescribe it because homeopathy is solely based upon symptom similarity. If the child is throwing a symptom of nosode, you go ahead with the nosol. If the child is having a strong miasmatic history and we are coming across two remedies, one is nosol and one is not, and he has strong indication of nosol, go ahead with the nosol. But he doesn't have a strong indication of nosol, please don't go with it.
Okay, that still looks a lot of questions or a lot of points to be answered or reflection is needed there. There is a doubt in the chat box. What potency used in Merxol case?
200. That's
200 potency, yes. Then what was your father's condition and what was the medicine given?
So see, if I give you the medicine, that will be a specific. But the mazat, I gave his, I'll just tell you the observations, what I made and what remedy I gave. Okay. So I found 5 observations. One is the whole night I was in the ICU observing him. So what I saw was he was, whenever I used to sit in the ICU and I used to talk to someone, he was in semi-comatose condition. He used to be very acute and he used to try to turn himself towards my noise. Right. So I took senses acute.
Yes.
Second, whenever doctor or anyone used to come, he was in a semi-comatose condition or comatose condition. Doctor was asking him question. He was getting up, giving the complete answer and going back to that state. So coma, answering properly and going back to coma. Second symptom. Third, he was snoring heavily.
Yes.
First symptom. And most important symptom, what I noted was, his facial expression was as if he is having a deep sleep. I could sense a contentment in him. I took the rubric contented face expression and I gave him a single dose of opium. And rest was his recovery.
Okay, the point you just mentioned about the nosodes and use, you can see a lot of situations where the material always says, when the very self remedy fails to act, even Hanuman himself advises you to give opium. So that is the stage where a lot of reflection is needed. From a few experiences, we can't say, because all these were written from a comprehensive experience of masters. So that is a word of caution I just mentioned. Now, time to conclude the session. May I invite Ahmad Hassan sir to express sort of thanks, sir, please. Yes.
Good evening to all, and thank you, respected our lecturer, our organization, and participant. On behalf of Ifph and our well-wishers, I extend you this gratitude, and also very pleasant note about your evidence-based practice that you showed the results of leukocytosis and it is coming down. So thank you very much. May Almighty bless you all. Thank you very much.
Yes, with that remark, let me conclude today's English edition. Hope you to meet the same time tomorrow. Till then, goodbye. And all Dr. Thanesh for a continuation of program in Malayalam.